In new information that has just emerged prior to this press conference, the genomic sequencing results have come back. And what they show is that the Berala cluster is actually the same genomic sequences as linked to our patient transport driver, not the Avalon. So just to recap, we have been dealing with two different strains that have been causing clusters. We had a person who had returned, a family group who had returned from overseas and were transported to a health facility. Unfortunately, one of the patient transport workers acquired infection, passed it on to a colleague. That colleague had been at the Berala BWS for a very fleeting amount of time, but what we now know is that transmission occurred. So it is critical that, because we know these transmission events have happened through very minimal exposure, we are asking members of the community who did purchase alcohol or enter that premises for that period to be very vigilant and take the public health action of isolating for 14 days if you were there at those times. This assists us greatly because it means that we have a clear line of the transmission, and it really does mean that we have less missing links. We are still concerned about a case that occurred yesterday where we still haven't managed to find links in terms of the Avalon cluster, and there are still, despite intensive investigations, inability to link the Wollongong. While we know genomically the Wollongong, Croydon and the Avalon clusters are linked genomically, we still haven't found that missing link there. So our investigations continue, and thank you very much for your cooperation.